church family. Thank you so much for giving me the opportunity to be one of the health speakers for the seminar. I know almost all of you, but I think some of you might not know me, so let me introduce myself. My name is Sheryl Palilingan, and I am married to Sakul. I work as a registered nurse in a level 1 trauma emergency department. I thought of what should my topic be today? But since I work in the emergency department, why don't I talk about everyday emergencies that we might not know or be familiar with. Every shift, I witness moments when seconds truly matter. Moments when someone's life depend on how quickly another person recognized danger and acted. And that's what I want to talk to you all about today. And more importantly, I want to talk about how this responsibility fits within our Adventist belief, our health message, and our calling to preserve life. So our Adventist identity and the health message as Seventh-day Adventists, we are known worldwide for our emphasis on health. This is not an accidental. God intentionally gave this church a message of health reform because healthy minds and healthy bodies allow us to serve Him fully. I would like to quote a Bible verse from Matthew 24, verse 44 that says, "Therefore, you also be ready, for the Son of Man is coming at an hour you do not expect." I'm sure we all are familiar with this verse. We often apply readiness to our spiritual life. But the scripture teaches readiness in every aspect of our lives, including our health. First Corinthians 14 verse 33 also says, "For God is not the author of confusion, but of peace, as in all the churches of the saints." In times of emergencies, confusions can cost lives. God values order, clear thinking, prompt or fast action, and prepared systems. God uses His tools to help save lives, such as in America, we have 911, there are paramedics, hospitals, and also trained responders, like doctors and healthcare workers. Today, I am not here to give medical training or to overwhelm you all with clinical information. My purpose is much more simpler and more important. I want to help you recognize if something is truly an emergency, when every second counts. Because in those moments, the difference between life and death often comes down to one decision. Do we recognize the sign early? And do we act immediately? Proverbs 22 verse 3 says, "The prudent see danger and take refuge." Notice what this verse says. It says the prudent see danger and act. Recognizing an emergency is an act of wisdom. Acting quickly can help us to save our life or other people's lives. So every day when I work, I often ask myself a difficult question. Every day I see many people with stroke, and then with heart attack, with sepsis, and some people, not some, I see a lot of people, they have stroke, but they did not know that it was a stroke. I thought to myself, what if someone had recognized the warning signs earlier? Many of the most serious emergencies, like what I have mentioned earlier, they don't begin dramatically. Sometimes these symptoms, they start quietly and deceptively. They sometimes they don't look urgent at first, so that make people wait. That make people, oh, maybe I just need some rest, so people would take a nap or sleep. And people hope, oh, it's gonna get better in the morning, or it's gonna get better after I wake up. But when they wake up and they don't get better, they go to the hospital, time has already been lost. That is why today we are going to focus on recognizing medical emergencies early before it is too late. So I have a few posters, and I want to take a few minutes to explain each one of this poster, because this is something I truly hope you remember, not just tonight, but you carry on with you for long, long time. So in these posters, there are 3 medical emergencies. The first one is about a stroke. The second one is about a heart attack, and the third one is about sepsis. They're all very different diseases, but there is one thing that they have in common. They can first look mild, but they can become life-threatening very quickly if we don't recognize this early. Now, I would like to start with stroke. How many of you have known people or families or friends who have had strokes? I'm sure a lot of us have families who have had stroke before. So in the hospital, we use the word or the acronym FAST, F-A-S-T, because it helps us remember this matter. And also FAST because it's time. So the first time that I want you to all remember, fast, 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 act fast. Fast, F, the first F, it stands for face. So if you see somebody having, so stroke can comes in many symptoms. A lot of people, they have like severe headache, like they, all of a sudden, oh my gosh, I have this really bad migraines or headache. Or sometimes they're walking and then working and all of a sudden, oh, I feel so weak, I need to sit down. And then they're unable to wake up. And this is not just applied to you, this can also apply for your friends, your coworker, or your family members. The first thing you can do is ask them to smile. So you can ask them if they're experiencing like severe headache or extreme fatigue or tiredness, ask them, hey, can you please smile? Smile. And then when they smile, if you notice something, is there any facial droop? Like one side of the smile is not, it's like droopy, or the eye is droopy, or you can tell if it's a stroke because it is very prominent. And then the A stands for arm weaknesses. In the emergency, what I do is when I try to ask them, I ask the patients to usually lift up their arms. And this is what you can do. Ask them to lift up their arms and hold it for 10 seconds. So you would count 1, 2, 3, 4 until 10. If one of the arm fall down or becomes weak, then you know that that is a major red flag. And then the next one is speech. It's how they talk, like how they speak. You ask them, can you tell me your full name? Or ask them, can you tell me your date of birth? If they're having like a slurred speech or you're having a hard time to understand, know that that is a major red flag as well. And then T, the last one, T, it stands for time. So if you see any of these signs, it is very important that you call 911 immediately. And then I want you to know that one of the important thing about stroke is that sometimes stroke is not always painful. Sometimes people, they don't have headache or they don't have weakness. I had a stroke patient one time. He came to the emergency and he was my patient. He said, nurse, I was out at lunch with my wife and all of a sudden one of my eye just suddenly became very blurry, and then he lost his vision in one eye. And when I did my test, his other eye cannot follow when I asked him to follow my finger. And then when I took him to CT, sure enough, he was having a stroke. So I want you to also remember that one of the thing is that sometimes stroke is not painful. Sometimes it's not headache. And then just remember fast. If you recognize somebody's having like a weakness or like blurred vision or headache, remember fast, fast, fast. Face, and then arms, speech, and time. The next one that I want to talk about is heart attack. So this poster tells us the common heart attack warning signs. The first one, you will feel sometimes people feel pain or discomfort in the chest. But sometimes it can also, sometimes it's also feel pain. Sometimes it just feels like I've had people come to the emergency room because they can't breathe. They're like, I can't breathe, or they feel like it's heavy on the chest. They don't have any pain or anything, but the most common symptoms that we see is chest pain. Sometimes this chest pain can spread to the arm, to the jaw, and the neck. And then sometimes it's also accompanied by nausea, sweating, or they feel lightheaded. It says here that women especially may have less obvious symptoms. Sometimes women, they don't have chest pain or chest tightness at all. Sometimes they just feel tired, or they feel like nauseated, like rasa muntah, rasa mual begitu, or back pain. But if something feels wrong, especially, this is the key word, especially if it is sudden, like sudden onset, like you are healthy at first and all of a sudden you have this feeling, that is a red sign. And you should not drive yourself. I would ask you to maybe ask your husband, wife, or your family member, or even call 911. The last emergency on this poster is about sepsis. Until I was in nursing school. So sepsis, according to Cleveland Clinic, it is your body's extreme reaction to an infection. Without prompt treatment, it can lead to organ failure, tissue damage, or death. So sepsis is a life-threatening emergency. How this happens is sometimes we get infection, sometimes like women, we often get UTI, or in like flu season like this, a lot of people get cold and then later they get pneumonia. Or sometimes like an open wound, like a wound that is not cared for, become infected, it could lead to sepsis. The immune system usually fights it and help you heal. But with sepsis, your immune system, they don't recognize that this is, they don't recognize like this symptom, so they go into like an overdrive. They work extra. So instead of just attacking the infection itself, your immune system starts damaging the body's organ, like organs and tissue. And then that's why sepsis causes organ failure that would later cause death. So this is the signs and symptoms of sepsis. If you all have like the small oximeter, do you know like the, like the pulse ox? I'm sure a lot of us have, because a lot of us here are host home providers. We have that, or we have like the blood pressure cuff. If you notice, you will have a very fast heart rate. So the normal heart rate for adult are 60 to 100. If your heart rate is above 100, and then you have low blood pressure, that is usually one of the major signs of sepsis, is that they have low blood pressure. And then sometimes you have fever or hypothermia, and then you feel extreme weakness, or you feel cold, shaking, and chills. And then for older people, they can become confused or disoriented. And then the other things here, sometimes they have shortness of breath, sepsis rash, and extreme pain or discomfort. I want you to remember that sepsis, it doesn't just happen as sepsis. Sometimes it starts with just a flu, or just you get a cut that you don't care for and then get infected. Or like women, we tend to get UTI, and if it doesn't get treated timely, it's not treated quickly, it can become sepsis and then affect organs such as lungs, kidneys, heart, or even brain. Without fast treatment, these can lead to organ failure, shock, and death. One of the reasons I brought sepsis into my topic is because sepsis is so dangerous that it can get worse just within hours. And you can decline within hours and progress to death. That's why recognizing the warning sign is so very important. Okay, so these are the 3 posters that I presented tonight. I want you to notice something important about these posters. So, if you see this, you know you don't need any medical equipment to recognize these symptoms, right? They are fairly easy, like stroke, heart attack, or sepsis. You don't need a degree to recognize these emergencies, and you don't have to be a healthcare professional to recognize this. You just need to pay attention and act quickly. And this is my health presentation for tonight. Thank you so much for Maranatha SDA Church for the opportunity to share this message. And I pray that tonight may God give us wisdom to recognize danger and act quickly so we can save lives. Thank you and God bless you.